Good afternoon, I'm Giovanni Dennis with the Midday News. A special welcome if you're joining us online at onespotmedia.com. Jamaica is now in a serious situation as hospitalizations are at an all-time high. That's according to Health Minister Dr. Christopher Tufton. However, Dr. Tufton says provisions are now being made for additional bed capacity in order to meet this demand. Shamila Pullen has the latest.
More than 80% of bed spaces are occupied at public hospitals as the country continues to grapple with an increase in COVID-19 cases. Speaking at a media briefing on Thursday, Health Minister Dr. Christopher Tufton says this is worrying.
Currently, some 309 of the approximately 362 COVID-19 beds across the island are occupied, making the occupancy level for COVID-19 beds the highest it has been to date at some 85.4%. So occupancy of our COVID wards, these are wards that we constructed in the early days of COVID back in February, March and beyond.
Dr. Tufton also said that the field hospital that was donated by the U.S. government and was installed at the National Chest Hospital will be relocated to the Spanish Town Hospital because that facility is overwhelmed. The health minister also said that additional beds will be available at two field hospitals built at Falmouth in Trelawney and St. Joseph's Hospital in Kingston.
We have 362 beds now at an 85% capacity. We're adding an additional, over the next few weeks, 133. So that would be the 72 from the two built-out permanent structures. The 21 additional at St. Joseph's, and the 40 from the field hospital donated by the U.S. government, which would give us now an additional 133 plus the 362. So we would ultimately have some 495 COVID beds, which would represent approximately a 35% or so increase.
In the meantime, Dr. Tufton says the issue of staffing for the field hospitals remains a challenge. However, that is an issue the health team is working to fix.
We are making arrangements to deploy and to redeploy. We have some recently minted nurses who are going to be accredited or certified by the Nursing Council. We had some doctors that we had put brought in, 121 late last year. So there are arrangements that are being made, but it's still a very challenging period because there's also downtime from the existing personnel for one reason or another.
Shamila Pullen, TVJ News.
In the meantime, the health minister is making another appeal to companies to adhere to the COVID-19 protocols. Dr. Tufton says the ministry is now seeing a worrying increase in workplace clusters. He said quite a few clusters are observed in the private sector in Kingston and St. Andrew.
Mandeville Hospital being perhaps the most prominent in the last few days. We have seen the release put out in terms of the Ministry of Culture and Entertainment, a small cluster there. But we have also seen a number of clusters in the private sector. And in Kingston and St. Andrew alone, there have been some 7 organizations with cluster of positive cases, I think, over the past week or thereabouts.
Dr. Tufton says the guidelines are clear as it relates to the outbreaks. He says if employees are sick, they should stay home.
Going to work while feeling ill may be an act of commitment, bravery, if you will, in these times with COVID, particularly if you have symptoms that suggest COVID. Going to work while feeling ill is not smart, it's not wise. It's not good for the entity because you could be spreading COVID and creating further mayhem. It's not good for you because you need to recover, and isolation is key.
And more than 600 healthcare workers have been receiving training for administering COVID-19 vaccines. This as part of preparations for when the first batch arrives in the country. Health Minister Dr. Christopher Tufton made the announcement last evening during a virtual press conference. Sandy Williams reports.
About 2 weeks ago, Health Minister Dr. Christopher Tufton announced that Jamaica is expected to begin administering the AstraZeneca coronavirus vaccine this month. No date was set in stone for when the program would commence, but speaking Thursday evening during a virtual press conference, the health minister said the government has been making preparation for a smooth start. Dr. Tufton said some 662 individuals, most of them public health nurses, have been training for administering the COVID-19 vaccine.
In the southern region, we have 170 persons in training. Southern region being Clarendon, Manchester, St. Elizabeth. In the northeast region, which is Portland, St. Mary, and St. Anne, we have 120 persons in training. In western region, Trelawney, Westmoreland, St. James, and Hanover, we have 140 persons in training. And in the Southeast Regional Health Authority, the largest region, that's the corporate area, Kingston, St. Andrew, St. Catherine, and St. Thomas, we have 232 persons in training.
Dr. Tufton added that his ministry, along with the Ministry of Foreign Affairs, will be working with the private sector to administer the vaccines when they become available.
We will be signing or agreeing to an MOU to work with them because they are also interested in playing a role, and we think we have to work together. But at the end of it all, our selection of a vaccine has to follow a protocol.
Jamaica is among the countries and territories that have subscribed to the COVAX facility under the administration of the World Health Organization, WHO. The WHO has developed guidelines on the basis of advice garnered from the Strategic Advisory Group of Experts, SAGE, on immunization. The health minister said he will be guided by those recommendations to administer the vaccines.
And I want to reassure the public that we will not embrace or endorse any vaccines that falls out of the protocol of going through the expert assessment that the World Health Organization traditionally subjects a vaccine to before it is certified as safe.
Sandy Williams, TVJ News.
Meanwhile, health officials are touting the safety of the AstraZeneca vaccine, even for persons who fall within the vulnerable groups. Concerns were raised about the impact the vaccine may have on persons over 65 years. Director of Family Health Service, Dr. Melody Ennis, insists the vaccine is safe for them.
The review has found that the immune response that is induced by this vaccine in older persons is excellent. The safety profile is good, and therefore the recommendation from this group is that the vaccine is safe and efficacious and should be used in persons over 65 years.
And for persons with comorbidities,
these diseases, such as hypertension, diabetes, or cardiovascular illnesses, respiratory illnesses, and obesity, were studied in the trials, and the results indicate that it is safe for the vaccine to be had by these persons, and therefore the recommendation is that these persons who we know fare the worst with the illness will be vaccinated with the AstraZeneca.
Dr. Ennis said the vaccine is also safe for pregnant women. However, she explained that people with HIV/AIDS may not respond to the vaccine as persons without the virus would, but she insists it's still safe.
The response that is mounted will still provide a source of safety for these persons, and as such, it is also recommended that they be given the vaccine.
COVID-19 has claimed 5 more lives in Jamaica. The death toll is now 368. All the deaths were recorded in Kingston and St. Andrew. They involve 4 women and a man, ages 40 to 82. Meanwhile, 290 COVID-19 cases were confirmed on Thursday. Their ages range from 21 days to 102 years. The country's overall case count is 18,527. All parishes recorded positive cases on Thursday. Kingston and St. Andrew recorded 64 of the cases, St. Catherine had 44, while St. James followed with 42. And it's now time for a break here on the Midday News, but please stay with us. We'll have much more when you return. Welcome back, and we're continuing the news. A stern warning for residents of Trelawney to observe all COVID-19 safety protocols as the parish sees an upsurge in cases. Medical Officer of Health for the parish, Dr. Diane Dale, says the increase is putting a strain on the healthcare system. Codian Barrett reports.
As the demand for health services increases from people being infected with COVID-19, there are calls for residents and visitors to Trelawney to do more to prevent the spread of the virus.
I urge the residents and visitors of Trelawney to remember that COVID-19 is still very much present with us. Many persons infected with COVID-19 are not ill. They are not demonstrating any signs or symptoms of illness, but they effectively will transmit the virus.
She added that the lack of mask wearing has been rampant.
Persons are often not wearing masks. They are in public passenger vehicles within which they cannot physically be distant, and they are not wearing masks. Some have been telling my co-workers that, well, no COVID-19 in a fluid community, and that is so baseless.
The elderly and people with underlying health issues make up the bulk of the cases. It's suspected that these people contracted the virus in their households from other family members.
Practice the prevention measures at home. You have been on the street all day. You may have even gone to the illegal party. You went to the illegal grave digging, because many of these gatherings are prohibited by law right now, but they are happening. You may have gone to the drink up. You may have gone to the burial that was also illegal by virtue of the number of persons. You need to pay attention to what you do.
She also touched on the issue of quarantine breaches.
We have the persons who are coming from overseas and they are not maintaining quarantine, and it's being facilitated. Their breaching of quarantine is being facilitated by their relatives. And then who tells? They come and they go, and then they leave the COVID with you that they brought.
The parish also recorded its first case at an infirmary yesterday. Dr. Dale is urging everyone to do their part, including officiating ministers, in enforcing the protocols. The parish has so far recorded 18 COVID-related deaths. Codian Barrett, TVJ News.
Meanwhile, productivity in the parish of St. James is being impacted by the increase in COVID-19 cases. The parish's health department says it is increasing testing and sensitization in a bid to curb the spread. Javon Keys has the details.
In the last 24 hours, St. James has recorded 42 positive cases of COVID-19, bringing the total case count for the parish to 1,986. Acting Medical Officer of Health for St. James, Dr. Tanique Bailey-Small, says the parish is now seeing one of the highest number of active cases.
So we're looking at least now probably about more than 200 active cases at this time, which is more than what we would have had before. This means that we have to look at a holistic approach as we go towards this. So for health, we have been focusing on increasing our testing, yes, but also trying to reach out to our population in terms of behavior change.
She says a number of business operations have been significantly hampered.
We are now seeing where it is affecting productivity. We are seeing an increase in terms of workplace clusters increases in terms of cases in communities, increased contacts of positive cases.
Dr. Bailey Small says they have ramped up parish-wide activities in a bid to reduce the spread of the virus. She's encouraging citizens to continue adhering to the COVID-19 protocols. Javon Keys, TVJ News.
Sticking to St. James, members of the Municipal Corporation are adding their voices to the call for more funding for road repairs to be given to the municipal corporations. Councillor for the Montego Bay Northeast Division, Charles Sinclair, says the National Works Agency, NWA, is out of touch with what is happening in the municipality.
The National Works Agency has been missing from this council for over 1 year, based on and probably even longer than that. And I cannot see how anybody from this council, whether it's the superintendent, the mayor, or the deputy mayor, and I didn't sit in any meeting prior to that Mr. coming out and tell me about National Works Agency. Because I have a particular view of the National Works Agency.
Councillor Sinclair thinks the municipal corporation should be given the funds to repair all roads in the parish instead of the NWA.
In fact, I believe that you don't even need a National Works Agency in every parish. We can have National Works Agency operating regionally, and they have a particular function, which is to deal with major construction of roadways. So if you're going to construct a new road, National Works Agency. For regular maintenance of roads, the municipal corporation must deal with maintenance of road.
And still out west, the Trelawney police say they have cleared up 2 murders which took place in the parish since the start of the year, namely the contract-style killing of Andrea Lowe Garwood at the Agape Christian Fellowship Church in Falmouth and the shooting death of 4-year-old Chloe Brown in Freeman's Hall. Chloe was killed on Monday, January 11. It's reported that about 1 o'clock, Chloe and her father were at home when a knock was heard on the door. Her father went to check and was accosted by gunmen. There was a tussle and he was shot in the leg. Chloe was shot in the abdomen. The other incident happened on Sunday, January 31 that should be, where Mrs. Lowe Garwood was shot multiple times by a gunman who entered the church posing as a member of the congregation. Speaking at the Municipal Corporation meeting on Thursday, head of the police in the parish, Superintendent Carlos Russell, says the brazenness of Mrs. Lowe Garwood's killing shows the scant regard for any level of sacredness.
When you see that someone will have the heart to go inside of a church to murder someone, then we wonder where we are going as a nation. Because growing up, this has always been a taboo. Never see a man or hear a man talk of going into a church to do a crime like that.
Superintendent Russell says all the people implicated in those murders have been charged. One of the 3 men charged in connection with the shooting death of Mrs. Lowe Garwood in Falmouth, Trelawney last month has had his case mentioned in the Home Circuit Court this morning. He's 23-year-old Leon Hines, a storekeeper of Rose Heights, Montego Bay, St. James. Mr. Hines is charged with murder, illegal possession of firearm, accessory before the fact, and accessory after the fact, as well as conspiracy to commit murder. He's scheduled to return to court on February 18 when he's expected to plead guilty. The court heard that Mr. Hines is in the process of entering an agreement with the Office of the Director of Public Prosecutions. The other men charged in the matter are scheduled to appear before the Trelawney Parish Court on Monday. The government is on a quest to find more cost-effective housing solutions for low-income earners. The Prime Minister made the revelation on Thursday at the handing over of one facility in the St. Andrews South East constituency, or in the St. Andrews South constituency, under the National Social Housing Program.
Long time coming for Vanicia Reid and her family. After applying in 2016 for a house through her Member of Parliament, more than 5 years later, the dream of a new home is now a reality.
I'm blessed to be the owner of this house, and I just want to express my gratitude to everyone who made it possible. And again, I'm really grateful and a big thank you.
She is one of the 315 Jamaicans expected to benefit from the housing solutions under the National Social Housing Program, NSHP.
Of the 315, we have about 290 applications received, and about 213 of the 290 have already been approved.
5 houses will be built in each of the 63 constituencies.
As at January 31st, 2021, a total of 15 housing units have been completed under the program at a cost of 120 million Jamaican dollars. That works out roughly to about $8 million per housing solution. Currently, there are 28 active construction projects ongoing, and they range from between 5% completion to 99% completion.
By the end of March, the Prime Minister says construction of another 114 houses should begin at a value of $1.17 billion. But Member of Parliament for St. Andrew South and Opposition Leader Mark Golding says while it took some time to come, he's grateful that at least one of the 5 houses is complete. However, he has concerns about the widespread sustainability of the program.
As beautiful as this is, Prime Minister, it's clear to me that this is not a sustainable approach to dealing with the housing shortage and housing needs of the inner city, because the cost of this particular unit would not be something that the government could replicate in any sizable numbers. But it represents, I think, an aspirational symbol of what Hopeful Village would love to be.
Prime Minister Andrew Holness agrees. He says the program is important to the communities because of the kind of change it represents. However, the government is looking for a more scalable solution.
We need a cookie-cutter solution. Let me explain what that is. We need a solution that meets all the requirements of a house that is strong, durable, comfortable, aesthetically appealing, easy to construct, that you can just come and within a few weeks you put it up. Not much work needs to be done on it, and it is ready to go, and you're coming in under $5 million.
Mr. Holness says the government will be launching a competition to help identify these solutions. Javon Keys, TVJ News.
To news and sports, the West Indies are in the ascendancy against Bangladesh in the second test after reducing the hosts to 105 for 4 in their first innings reply at Storm Sunday 2 in Dhaka. They trailed by 304 runs. Mushfiqur Rahim 26 and Mohammad Maithoon 6 were the not-out batsmen at the close. Tamim Iqbal has so far top scored with 44. Shannon Gabriel was the pick of the Windies bowlers with 2 for 31, while Alzari Joseph and Rakeem Cornwall have taken a wicket each so far. Now, earlier the West Indies were dismissed for 409 in their first innings after resuming on 105 for 4. Joshua De Silva carried on to 92 from his overnight 22, while Jamaica's Nkrumah Bonner made 90 after resuming on 74. Abu Jaid took 4 for 98 and Taijul Islam took 4 for 108. And that's the Midday News. I'm Giovanni Dennis. Join us for 7 at Primetime News. On behalf of the news, sports and production teams, have a good afternoon.